So the first case I want to go through is Heather. She's a 41-year-old female, and she presented with some burning in her neck that's been there on and off for a while. We'll go over that in a bit. And what triggered her to come in is in the last 3 weeks, it has sort of spread across her mid-scapular and thoracic region. So currently she presented to the clinic with 3 out of 10 pain.
Yeah, let's talk for just a moment. So the patient's primary complaint is neck pain with some mid-back symptoms. You know her from before. When you have a patient in this situation where the primary is neck, she did mention the headache, although you have it marked here as rare. Talk to us about to what degree you're going to dive in and flesh out whether or not this headache is something to be concerned about, or do you just focus on the neck symptoms themselves?
Well, I didn't on this first day, to tell you the truth, because she said, oh, it's rare. And I said, well, how often do you get it? And she said, oh, I'm not sure. So often when there is some headaches, but the chief complaint is neck, the headache just kind of takes care of itself as you take care of the neck. So,
Audrey, talk about that crepitus. We hear it so often. Can you hear that sound? I can hear it. It seems like someone could hear it from across the room. And what does that mean? And is that going to get better? All those concerns that we have, how do you handle those questions?
a couple of different ways, depending how the patient presents it. And, sometimes I'll just say, if your neck has been stiff and you haven't been moving it, the joint isn't being well lubricated. So when you first start moving it, it kind of...
Okay, Audrey, so you're at the end of page 1 here. Like you said, it's pretty straightforward. You're familiar with this patient at any rate. Where are you in your mind as to what's most likely, or what are your 2 or 3 classifications or scenarios that you're thinking?
For classification, I'm certainly thinking it's a recurrence of her derangement that she had in the past. And, does she just need some tune-up and reminder was my primary consideration. And it certainly was.
All right, so your physical exam, will you walk us through that?
So she was sitting fairly well. So she did remember that I was going to probably pick on her for that. And sitting nice and symmetrical, we did the usual postural correction thing, and it didn't change that symptom in her neck at all. And I didn't bother with a neurological exam for her. And then we went into range of motion, and she wasn't having pain. It was mostly a tight feeling for cervical going on when, lower cervical, they'll often be coupled together. So if they're tight with right side bend, they'll be tight with right rotation. And when you see this, at least her symptoms were opposite, right? It was right lateral flexion and left rotation. So different movements made me think, oh, that's an upper cervical pattern. But again, because I wasn't ignoring her headache, I kind of missed that, to be honest. The headaches go into that. So I went into a prone extension.
Okay.
Just thought I would check that one first and held her in that position. And the headache started to decrease, but it didn't change location. It didn't stay better when she sat up.
Audrey, do you have to go back to the sagittal plane in upper cervical spine like this? I'm assuming I know the answer, what you might say, but I thought I'd ask the question because I know it could come up.
Yeah, and I would. In this case, she hadn't really stopped doing the sagittal plane.
Interesting case. The big take home with this, or the takeaway from this, from your perspective, is what?
How important visit 2 is. I had a shoulder recently that I misclassified on day 1 as well. So I almost think visit 2 is as important or more important than visit 1. And the tidy up, and then just those little things that you notice, whether it's for her, it was in-range pain on rotation, or, once in a while she gets a headache, little things that you might have ignored, that if they're on the form and something goes wrong, visit 2 or 3, and go back and say, I was interested in what happened there before.